Welcome, ladies and gentlemen, to another episode of Lockdown Conversations with Kim and Smriti. Today is a very important day. Today is the Cancer Survivors Day, celebrated every year on 7th of June. This is a day to mark the courage of survivors and to meant to demonstrate that life after cancer can be a reality. In today's episode, we will clear all your myths about cancer and doubts about the present scenario of COVID 19.
And so we have some special guests with us today who are ex-ASPNs. Please welcome Dr. Vishnu Sanal Kumar, who has been selflessly serving in the field of oncology for the past 15 years. We have Dr. Aditya Krishnan, a radiation oncologist who has been treating cancer patients for the past 6 years. And we have a general practitioner, Dr. Reema Rajiv, who has been serving in the medical field. Welcome, doctors.
So, I would like to start by asking Dr. Vishnu some questions. First of all, doctor, can you explain us the basic idea behind cancer?
Yes, why not? Cancer is basically a disease involving abnormal cell growth with the potential to invade and to spread to other parts of the body. But some do not spread like that. For example, benign tumors. Some early symptoms include lump, abnormal bleeding, prolonged cough, unexplained weight loss, and change in bowel movements. They can also have some other causes. The risk factors or causes for cancer include tobacco, excessive alcohol consumption, lack of physical activity, obesity, poor diet, etc. Some of the basic treatments that we use against cancer includes radiation therapy, surgery, chemotherapy, and targeted therapy.
Doctor, can you tell us about your experience and the determination of real life cancer survivors?
Yes, why not? Well, I have treated a lot of patients, but in order to tell all the experience might consume a lot of time. I'll just tell about the basic views that I have felt about my patients and how their how they were performing mentally and emotionally. The best part of the job is when the treatment works. Occasionally, there are also miracles. But what I found special in all these patients was their strong willpower and their determination to overcome the disease. They're always optimistic, and even when I am stressed due to my busy schedule, I would have a conversation with them, and this gives me a positive vibe. Most of the people, especially students, get stressed up due to small tests, examinations, presentations, etc. They get depressed and accept failures even without trying. But these cancer patients, even after knowing that their end is near, they are confident that they would overcome the disease. The greatest lesson I have learned being an oncologist is that if one is confident, determined, and optimistic, then she will be able to manage any stressful situation in life. So, to all the youngsters hearing me, just follow your dreams and believe in yourself.
Thank you so much, doctor, for the valuable information for our audience.
Now I would like to ask a question to Dr. Aditya. Sir, could you please tell us your opinion on myths about cancer, whether eating sugar will make cancer worse or cancer is contagious?
I've written down the three most common questions that can be found on the web. So I'm going to address to these questions. Is cancer a death sentence? Obviously not. My personal experience has taught me that every problem has its own solution. Cancer is not an inevitable end to a person's life, but an obstacle that can be easily bypassed. But it's equally important that the affected seeks medical aid rather than ignoring the symptoms such as small lumps, etc. So the second question is, will eating sugar make my cancer worse? No. Although research suggests that cancer cells consume more sugar than normal cells, no studies show that eating sugar will make the condition worse. However, high sugar diet may result in obesity, weight gain, etc. However, hence it is best to avoid overconsumption of sugar. The third question is cancer contagious? Cancer is not a contagious disease that spreads from one person to another, but there are instances when cancer spread from one person to another via organ transplant. If a person receives an organ from a cancer patient, the person has an increased risk at developing transplant-related cancer in the future. But the possibilities of such cases is nil. In the end, cancer is not like any average virus or bacterium that can spread in the public.
Thank you, Dr. Aditya.
Now, I would like to ask general practitioner Dr. Reema Rajiv some questions. Dr. Reema, in the situation of COVID-19, we all need to be alert and aware. What are the precautions to be taken and how to keep ourselves engaged during quarantine?
So some of the basic precautions that we all can take is to first regularly and thoroughly wash your hands with an alcohol-based rub or
To be taken and how to keep ourselves engaged during quarantine.
So some of the basic precautions that we all can take is to first regularly and thoroughly wash your hands with an alcohol-based rub or wash your hands with soap and water. And then make sure that you and the people around you follow good and clean respiratory hygiene. And next, seek immediate medical attention if you experience any of the COVID symptoms such as cough, fever, and difficulty in breathing. And try to avoid crowded places as much as possible. And now, since most of us are indoors, let us try to spend this quarantine period by doing something, by trying to make ourselves a better person, by trying to work on our flaws, and by trying to work out on our mental health. Try to avoid any negative thoughts influencing our, try to avoid our negative thoughts by engaging yourself in various activities. So try to learn a new language or try to learn a new instrument. Just let the creative juices flow. And last but not the least, just stay social. Physical social distancing Physical social distancing does not mean that you should socially isolate yourself. So go FaceTime your family or go Skype your friends.
Doctor, with the increasing use of social media, there are many false rumors spreading. Can you make us clear with that?
Yes, even I have heard such false information being spread through the social media. One of the most common I have seen is that thermal scanners can help prevent COVID-19. However, this is not true. Thermal scanners cannot detect COVID-19. Similarly, antibiotics cannot work help prevent COVID-19. And exposing yourself to the sun or temperatures higher than 25 degrees Celsius cannot kill the virus. And last, consuming more alcohol does not help you prevent getting the COVID-19.
Thank you, Doctor. This shows the effort put together by the medical staff, the government, as well as the policemen for our safety.
Now, by having a conversation with all three doctors, we have come upon a conclusion that if you're determined and dedicated, you can always follow your dreams.
Thank you, doctors, for joining us and keep watching Lockdown Conversations by Kim and Smriti. Stay home, stay safe.